I always eat right, and I do lots of exercises. I run. In the winter when I can't run, I work out, and I don't sit still. You know, I've always tried to take care of myself, and I just never thought that, you know, somebody that would take that good of care of themselves would, you know, have a heart attack. Just something I didn't even imagine would happen to me. We would have tried to go any further that I would have even survived. So if we would have tried to go out of town, even to Buchanan, there's no way I wouldn't have made it.
We serve about 85,000 people in the surrounding areas in 5 counties, and so it's a very busy, small, rural emergency department, and we need to grow so that we can better serve the communities that we take care of.
I've been a nurse in the emergency department for 20 years. Actually, I started here whenever the department was just redesigned and new. Since then, we've seen about 500,000 patients through this emergency department if you run the historical data on that. That's a lot of patients. And we have a 15-bed ER. That being said, there's not a lot of privacy for the nurses to do their documentation. It's not an ideal situation for them to work in there, standing at computers, and there's not enough counter space. The other thing, as far as the new emergency department goes, we have an open floor plan in here, and in the past that's been designed for emergency departments. Now with HIPAA, privacy is something that a lot of facilities are going towards, and infection control. Whenever you have individual patient rooms, it's much easier to maintain good infection control measures.
We have a much stronger focus on continuing to improve the health of the patient, not just treat the specific disease or condition or injury that brought them to the ER in the first place. It's really about staying connected to the patient and growing our ability to help people stay well, to live a healthy life, and provide a full range of services that allow people in this region to enjoy the health and the life that they have.
We absolutely treat the majority of our patients here. You know, there are a few specialties that, you know, we do send away for, but most of our patients are treated here on site. With the addition of more beds and new equipment, we would be able to handle a larger volume of patients in a quicker period of time, and that's always in everybody's best interest.
With Fast Track coming through, we have a lot of patients that come in for headaches, you know, not really in an emergency type of situation. And this Fast Track is going to be very quick, you know, get them in, get them out. And you're not going to have all that weight you're going to have in the emergency that we have right now because we have limited space.
You know, a $2 million vision is huge. It's huge for Davis Health System, it's huge for this community, it's huge for any community. It's not just a few contributions, no matter how large, that can achieve that. It's everybody coming together as community and giving it at the level they can.
This is a small town, and small town people stick together. We want our town to be the best town in the world, and it's just like this hospital. We want this hospital to be the best. This is us. I mean, this hospital is us.
You know, I think as we drive through town or through our community, we point out that's the church where my piano recital was when I was a kid, or that's the playground where I played Little League. And for folks to be able to drive by and say, I remember when we helped build a new emergency department, or I remember when there wasn't a Davis House to serve patients and families. I think there's great pride in that, and it just becomes sort of one of your family stories that we're in this together.